Good afternoon. My name is Reesee and I'm excited to be here with you today. Did you know that as of 2013, the percentage of children who did not receive some sort of vaccination was less than 1%? But since then, some numbers have increased and there has been several cases of outbreaks of vaccine-preventable diseases such as mumps, measles, and pertussis. However, prevention is simple and it can be achieved by making sure that parents have the proper knowledge of vaccinations and that all children are vaccinated. To solve the problem of outbreaks, individuals must be educated on why it is important to immunize children. Spreading immunization knowledge to the public is a good idea because they will understand general vaccination information, such as which ones are recommended and which ones are required, and like the ages. It will rule out myths that follow vaccinations and gain insight as to why it is so vitally important to vaccinate your children. First of all, before one can prevent disease outbreaks from occurring, he or she must understand what common vaccinations are recommended or required for their children and at what ages they must get them. One of the first ones that they get is hepatitis B shot. The first dose is given typically at birth. The second dose is 1 to 2 months after the initial dose. You also have DTaP, which is diphtheria, tetanus, and acellular pertussis. The first dose is 2 months, second dose 4 months, third month 6 months. Third dose, 15 to 18 months, and fifth dose is 4 to 6 years. You also have the inactivated poliovirus vaccine. The first dose is 2 months, second dose 4 months, third 6 to 8 months, and fourth 4 to 6 years. You have the measles, mumps, and rubella vaccine. First dose is 12 to 15 months, and then the second is 4 to 6 years of age. You also have the rotavirus vaccine, but it's different. It's given orally instead of a shot. The first dose is 2 months, second is 4 months, the third, and there's a possible third dose, and it can be given at 6 months, but it depends on the brand. You also have the varicella or the chickenpox vaccine. The first dose is typically given 12 to 15 months, and the second is a booster, and it's 4 to 6 years. And people can start this vaccination later if you've not previously had the chickenpox. These are just a few of the many vaccines that are recommended to control the spread of infectious preventable diseases. However, some parents choose to opt out of immunizing their children because of rumored link between vaccinations and autism. These are two examples, measles and mumps, of just two diseases that can be prevented by vaccinations. In recent years, there's been a sense of uproar regarding anti-vaxxer parents, which are just parents that refuse to vaccinate their children. They do this because specifically the MMR vaccine, which is measles, mumps, and rubella, it raises the risk of autism in children. This was a theory or an experiment done by Andrew Wakefield in 1998, but since then has been discredited and found fraudulent. Since this study, there have been several medical experiments and studies done, and it is found that there is no actual link between vaccinations and autism. But now that they stop vaccinating their children, the problem goes now beyond autism medically because there is a decline in vaccinated children, which leads to a spread of disease. It is so vitally important to vaccinate children because it eliminates and controls the spread of disease. Over the last 3 years, there have been several instances of outbreaks in the United States. For example, you have colleges that are being hit super hard with the spread of disease, such as mumps, which makes this relevant to even us college kids. Two of the largest university outbreaks hit Iowa and Illinois in 2015. This was an epidemic of the mumps, which can be prevented by MMR vaccine, and it affected 6 people. There was also a measles outbreak in Disneyland in California in 2014 and 2015. However, both of these situations could be linked to the fact that parents were opting out of the MMR vaccine due to them linking it to autism. Considering that there is an abundance of medical research that proves the control of outbreaks and discredits the link to autism, I believe that parents should be educated about vaccinations and that every child should be vaccinated because it is safer for the general public and for the childhood itself. Overall, there is a higher need of parental education and an increase in children receiving adequate vaccinations. This problem can be fixed by properly educating new parents on the importance of vaccinations and making sure to keep ourselves and our children updated on their immunizations. Thank you for your time.